How can frontotemporal dementia surprisingly spark creativity? Have you ever wondered how a condition like frontotemporal dementia can lead to unexpected bursts of creativity? Frontotemporal dementia, or FTD, primarily affects the frontal and temporal lobes of the brain. This type of dementia can lead to unique changes in behavior and cognition, including surprising artistic expression. In many cases, FTD damages the left frontal and temporal lobes. These areas are crucial for language, social behavior, and executive functions. As these regions deteriorate, patients may lose some verbal and social inhibitions. This loss can create a kind of releases effect, allowing other parts of the brain, especially in the right hemisphere, to become more active. The right parietal lobe, which is linked to visual and spatial processing, may become more engaged, leading to an increased desire to create art or even uncovering artistic talents that were not previously expressed. Research indicates that in some patients with FTD, particularly those with the temporal variant affecting the anterior temporal lobes, visual artistic skills may remain as intact or even improve. As the left temporal lobe declines, brain imaging studies show heightened activity in the areas responsible for visual processing. This suggests that the decline in language-dominant areas might free up resources in the brain, enhancing creativity in visual arts. However, this creativity is not just about producing more art. It involves complex cognitive processes. The ability to think divergently, which means generating multiple original ideas, can vary based on the specific type of FTD and the extent of damage to the prefrontal cortex. For instance, patients with the behavioral variant of FTD might generate many ideas due to preserved memory access but may struggle with originality because of frontal lobe damage. On the other hand, those with the semantic variant may find their fluency impaired due to degraded semantic memory. Interestingly, repeated engagement in visual art can lead to structural changes in the motor cortex, particularly when using the right hand. This suggests that the act of creating art may reinforce neural pathways associated with creativity. In summary, frontotemporal dementia can spark creativity through a combination of neural disinhibition, increased activity in visual processing areas, and structural changes related to artistic expression. This phenomenon offers valuable insights into how dementia can affect cognition in ways beyond just memory loss. However, it is essential to remember that this increased creativity is not universal among all FTD patients and is closely linked to specific patterns of brain degeneration. Always consult healthcare professionals for personalized medical advice and support.